let's get over that.
No. Well, I don't know what it is. It's people come in Fred. In the previous administration, they started the bailout of the automobile industry. So don't just give me this Democrat talk.
Look,
I'm going to finish, sir. Okay? I mean, I don't know what it is about interrupting this now, but...
Hello, Senator Conrad. Thank you for coming. My name is Joan Calvert. I'm a retired teacher. My insurance premiums this year jumped 26%. My biggest fear with any program is that insurance companies have way too much power, way too much money, and they're spending over $1 million a day trying to defeat anything that takes their money away. So we need to fix that. Thank you.
Yep.
Thank you, Senator Conrad. When you mention that our hospitals in this state are claiming that they will all go bankrupt if we have a public option, I think that's fear-mongering. Those people have so much money. We all know doctors and hospital administrators are not the average person like the people in this room. They have a lot of money. They are called nonprofit. They are taking that money at the top, dividing it amongst themselves. That is not caring about the people in this state, and for them to fill us with fear that a public health option will bankrupt the system of private health care is fallacious.
Let me just say this to you, Bonnie. What they're saying is not public option. What they are saying is public option tied to Medicare reimbursement. And in the House, the committee that reported public option tied public option to Medicare levels of reimbursement. And we don't need the hospital administrators to tell us. I know it. If we tie all of our reimbursement to Medicare, our institutions will go broke because Medicare is below the cost of those institutions. How do the institutions survive? They survive because not only do they have Medicare payers, they have private insurance, and they have people who are self-paying. It is those other people that give them sufficient additional funding to be above bankruptcy. And that's just the reality. It's not public option. That isn't what they're saying. It is public option tied to Medicare levels of reimbursement. Then
don't give up the battle for public option. Then it's fixing how that is going to work. I support the president. And what side are you on? Are you not supporting the president when he wants public option? Fix where the money comes from. You're the budget person.
Bonnie. Look, to fix it, here's what you have to do. In the House of Representatives that's based on population, North Dakota has 1 member of Congress. California, how many does California have? Anybody know?
36.
25. They have over 40. New York has 30. Florida, dozens. Texas. They aren't going to give up money. They're not going to say, take some of our money and go put it in North Dakota. So the reason that the House tied public option to Medicare reimbursement is because that is a good deal for the high reimbursement states that just happen to be the high population states that dominate the votes, Republican and Democrat, in the House of Representatives. When people say to me, well, just fix it, there's no possible way. The next event is in Minot, so we got a fair distance to drive. Yes, sir.
Yeah, you're really taking the heat here today. I admire you for it. I've never come to anything like this before. And frankly, to be honest with you, I am mad. And whether it be Republicans or Democrats, I don't see no accountability in this country anymore. I mean, the state